So hello, we are starting from history. Okay, Dr.
Okay, okay,
Hamza.
okay, right. Okay.
Okay. So your task is that an 11-month old child.
Mm-hmm.
Okay. Suppose she is Farida,
Mm-hmm.
mother is Salma. She comes to you because the mother complained that the child is not gaining weight,
Mm-hmm.
and
Okay.
you are an ST3 doctor. Take the
Right.
history out good.
Okay. So basically, 11 months child, female
Mm,
girl whose name is Frida, his mother name is Selma, and he
mm.
presented with the history of not growing, weight loss is there, right?
Yes, not gaining weight.
Okay, not gaining weight, right? Okay, okay. Shall I start? Give me 2 to 3 minutes. Okay, give me 2 to 3 minutes.
Okay, no problem.
Okay, shall I start?
Okay, you can start.
Yes.
Wait. I have to set the time.
Okay.
Okay, you can start now.
Okay. Good afternoon. My name is Dr. Hamza. I'm one of the trainee doctor here. So I believe I'm talking to Frida. I'm talking to Salma, a mother of Frida, 11-month-old female girl.
Yes,
Is that right?
yes. I'm
Okay.
Salma. Farida is my
Okay.
daughter.
Okay. So thank you. So as I'm going through your notes, so I found that basically Frida is not growing. Uh, right?
Yes, doctor. That's my
Okay.
complaints.
Complaints. So can you tell me in your words what is your main concern?
Main concern is that my child, she's 11 month old, but I think she is not gaining weight. Even sometimes I think
Mm-hmm.
she's losing weight, and
Okay.
that's why I'm so much thinking why she looks like that.
So she is not gaining. So when you notice that she is not gaining weight.
It's long back, like 4 6 months.
Mm-hmm.
Actually, she first time after birth, I think she was healthy, but after that, I missed like 6 7 months.
Mm-hmm.
She's
Mm-hmm.
not gaining weight, and then she started losing weight. You can say.
Mm-hmm. Mm-hmm. Okay. So can you tell me what was the weight at 6 7 month when you you noticed at 6 month 7 month what was the weight
I
of
forgot.
Salida
I forgot.
and what is the weight now?
Now I have measured the GP. They told that that is very much low weight.
Low weight, right? So can you tell me that is there anything you seem to be that has like bring it on anything like what do you think?
Yeah, sometimes it become worse, sometimes you get, but I cannot catching that. What is the
Mhm.
reason?
Okay, okay. So anything you have done for this? Have you gone to any doctor for this?
Yeah, I
As,
have go to the GP when was 7 month old. All time she's not gaining weight. Then the doctor telling me give healthy diet. I give her all the food, healthy balanced
Mhm.
diet, rice, fruit, vegetables, everything, meat, chicken. But I think I can't
Mhm.
do now. I want to know because already healthy diet I have given her.
Right. Okay. I'm very sorry to hear about that. Okay, so can you tell me is there any fever associated with it?
No, no fever.
Any way as weight loss is there definitely any swelling in the neck or anywhere?
No, no, there is no swelling
Is
in the neck.
is Farida irritable?
Yeah, she's irritable sometimes.
She is irritable, right? So is there any headache?
She's 11 month old. I don't think she can mention me that she's suffering headache or
Okay,
not.
okay, okay. Any problem with the like abnormal movements or fits?
No, no, no abnormal movements or fits.
What about vision and hearing?
Vision is good. Hearing is also good. You can ask one question.
Okay, okay. What about pale? Is she pale?
Oh, yeah. I also noticed she is pale.
Okay, right. Can you tell me about whether your child is having cough?
No, she has no cough.
Okay. Any difficulty in breathing?
No, no, no difficulty in
Okay.
breathing.
Does she feel like? Do you feel his heart beats?
Yeah, yeah. When I handling her, sometimes I feel
Mhm.
that she is beating hard.
Beating heart. Okay. What about any rashes on the skin?
Yeah, she has some eczema face. There is.
On the face. Okay. And what about swelling on the
Where
body?
swelling it? No, there is no any swelling in the body.
Okay. What about his pee?
Pee is okay. No, I
Okay.
have
What
any
about, I
comment.
mean, no increase in like pee or yellow color pee like that?
No, I have not
Okay.
noticed nothing in pee.
Okay. Any swelling in the front of the neck?
No.
And can you tell me about his poo?
Yeah, yeah, that is my big concern. Poo, she is loose
Mhm.
motions. That is her on and off, on and off. What I complain, always she's suffering that.
So can you tell me about how much amount of poo she do?
That I have not measured. She wear nappies, but yes, it's loose. I can say that is loose
Loose,
motions.
loose. Okay. What is the color?
Color normal.
Okay. What is the smell?
Yeah, it's really so much smelly, bad smell.
Mhm. And is that difficult to flush?
Actually, she potty on the
Mhm.
nappy, so no need to
Mhm.
flush.
Okay, okay, right, right.
But it,
Okay.
some greasy in the diapers. It
I
is
can,
look
I
like.
can, I can understand. Okay. So, okay. So, like you told me that you have been going to GP previously. Any history of trauma?
No, no, no any history of
And
trauma.
doctor basically any investigation, like any test was done when he you went to GP?
Yeah, they did. GP did some blood test, hemoglobin level. They found low. That is one. They tell
Okay.
me. Then they tell me take food regularly. Then I start giving food.
What was the hemoglobin? Can you please tell?
At that time the hemoglobin probably 8 or 9. I forgot.
Right. So any treatment done for that?
Yeah, they're telling that eating healthy diet.
Okay. Any improvement that have been seen?
No, no, she has loosened weight. That's why I come here.
Mm-hmm. Okay. 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 So any history of surgery? Any surgery that has been done?
No, no, no any surgery done.
No done. Okay. Can you please describe me about his birth when he was inside you? Any rashes on your skin?
No, no, there is no any
Any
rashes.
fever?
No.
When he was born, how she was born? Can you please tell me?
Till normal delivery.
Normal delivery. Okay. Okay. Normal delivery was there. Okay. So one thing I missed that is there any wheezing in the chest?
No.
Okay. Right. Okay. So okay. So okay. So whether he was admitted to NICU?
No, no. Discharge us, we go home.
Okay. Nothing was like that. So can you tell me about his jabs are up to date?
Yeah, she has taken up to date all the jabs.
Does he's growing otherwise normally like other than that like whether he is sitting properly
Yeah, yeah, she's 11-month old, She tried to stand by holding the furnitures,
right?
but
Okay.
can't stand, and sometimes she walk with holding. Okay,
Okay.
normal. I have no complaints about that.
Normal. Okay. What about his, as you told me about his nutrition, right? Like he has been taking rice, food, and
Hmm.
weaning has been done around 6 to 7 months, right? So
Yes,
can you
yes.
tell me, have, have you concerned that any food that has been causing some serious problem?
Yeah, actually, I can't catching this, but I think sometimes it's the diet related. It's
Mm-hmm.
also my questions. I want to do the test
Mm-hmm.
because sometimes it become worse, sometimes it improve.
So what do you think? It is rice or like bread or what is or yogurt
I can't catch.
or milk?
I can't catch what is the reason behind that. 9 months, 9 minutes.
Okay, 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 okay. So so you have a follow the diet, doctor, for this.
No, not following the diet, doctor. Just GP has given a chart when it was 8 month when the problem started after
Mm-hmm.
weaning, maybe probably. Then GP telling that okay, he's not gaining weight. Take food properly. Give her all the food. Then I started this diet. I know that.
Okay,
That's
so
why
can you?
I don't go in dietitian.
Okay, okay, okay. So can you tell me about where do you live? Like where do you live?
I live in my home.
Okay, like it is new home or old home?
Yeah, it's not. It's new home.
Okay. What about your husband? Is your blood relative?
No, you're not blood related.
And is there anyone in the family who is having a similar condition?
Yes, yes, not similar condition actually.
Mm-hmm.
His grandpa has a problem, this loose motion type problem. Okay.
Okay, loose motion diet problem, right? Does you know what is the condition he is suffering from?
Yeah, yeah, he was diagnosed as a celiac disease.
Oh, right. I'm really sorry to hear about that. Okay. So, and okay. Other than that, like what you do and your husband do for living?
My husband is a driver. I am a housemaker.
Okay. Okay. So, are you what other how much other like children do you have?
I have another one child.
Okay. So you are any kind of drug
I
like
don't
any
get the
medication,
question.
medication or any medication?
Me?
Yeah.
No, no, no.
And are you giving full time to Farida?
Yes, yes.
Does it compromising his health or not?
No.
What do you think? Okay, right, right. And can you please tell me about like about yeah, okay, okay, yeah, and that's I want to ask. I think so. That's
So
it.
at the end, you will tell that, okay, thank you for your time. I'll revise my
Yeah.
note, then I'll come back to you. So
Okay.
you have
Thank you for.
remained 1 minute, 1 minute,
Yeah. Okay.
20 seconds like that.
Okay, thank you so much for your time, Ms. Salma, and that was nice of you. And I have written up notes, and I will get back to you after discussion with my seniors.
Mm.
Okay.
So present your case and tell your DD.
Okay, I have to present in 1 minute.
Mm.
Okay, just a second.
No, no, no second. Start.
Okay, okay, okay. Today I have taken a history from 11-month-old child, from mother of 11-month-old child whose name is Frida. Basically, she has a concern she is not gaining weight, and from past 4 to 5 months when Frida was around 6 to 7 months, and in addition to that, the patient is basically having like basically not gaining weight, and in addition to that, he is basically having poo that is smelly, that is loose, and that is in addition to that there is also a rash on the face which could be eczema, and in addition to that he also looked pale, she also looked pale, and in addition to that in addition to that yeah, there is basically
What is
mm,
your diagnosis and what is your DD?
according to this, my differential diagnosis, it could be a case of gluten sensitivity, celiac disease. It could be a case of protein losing enteropathy, or it could be a case of like lactose intolerance as well. Yeah.
Okay. So tell me why you are telling and against your DD.
Sorry.
Why your diagnosis is that? What are the points favoring you the diagnosis?
Okay. What are the points? One is basically the child. The child is pale, he is basically having the stool that is basically pale, that is basically loose, and that is basically a smelly. In addition to that, there is eczema, and yeah. So
Okay.
basically the family history of celiac disease in the grandfather as well.
Okay.
And
So,
she is basically not gaining weight from 6 to 7 months, probably after giving the diet. Yeah,
uh,
that's why.
okay. So thank you very much for your participation. This is celiac disease. Normally come on the exam like patient 11 month with failure to gain weight or failure to thrive. The
Mm-hmm.
complaint included it can be loose motions present, facial eczema present since age of 4 months, start weaning at 6 months. He took
Mm-hmm.
cow's milk, yogurt and cheese, family history of celiac, mom and grandpa. So
Mm-hmm.
first of all, it was failure to thrive our chief complaints. We can ask like the onset course in duration, what make it better, what make it worse. After that, how can you know that the proven failure on losing weight? Like, is that the dress getting loose? Is the DP measure the weight? You ask about DP measure the weight. By
Mm-hmm.
that, we can about appetite. We can ask
Yeah,
Ali.
yeah,
Remember, any failure to
absolutely.
thrive will ask like that Ali. After
Mm-hmm.
that, we'll go any other concern, any chronic condition the child is suffering or not. So if you ask me
Mm-hmm.
any other concern, then I ask that yes, I have another concern that she is suffering loose motions. Huh.
Yeah, yeah,
Then on the
yeah.
present history, we will ask that when anyone
Mm-hmm.
tell that loose motions, we analysis these complaints like the frequency of the loose motions, amount, about the color, odor, consistency, pain, mucus, blood,
Mm-hmm.
undigested food, difficult to flush if using toilet, and greasy if
Mm-hmm.
using diapers, nocturnal
Mm-hmm.
diarrhea, swelling. So you ask amount, color you ask, odor you ask,
Mm-hmm.
difficult to flush. Normally you ask you all that. Then you
Mm-hmm.
can ask me about fever, weight,
Mm-hmm.
activity, sleep. So fever you ask. Then we
Mm-hmm.
go the systemic review one by one. First here can be GIT or from CNS you can start. See,
Mm-hmm.
from GIT we go. Is there any tummy size, tummy pain, any throwing
Yeah,
up,
that I
vomiting? We have
missed.
not asked.
That I missed.
Vomiting is very
Tummy
important.
dilation. Yeah, yeah. Tummy
All,
dilation.
alter,
Yeah, yeah, yeah.
mm,
Swelling of the tummy, I missed. Yeah, yeah. Absolutely, you're right.
yes.
Yeah.
Mm. Alternate with constipation, any yellow discoloration of the eye, any oral thrush, oral or anal soreness. Very important. Wasting of the buttock. Okay,
Mm-hmm.
wasting of the buttock we
Mm-hmm.
find is celiac disease. Then you can ask about chest, recurrent back cough. You ask chest, but in at the mid of the history, you come
Mm-hmm.
back and ask wheezing in chest present or not. It was not necessary. As you ask me two questions that cough,
Mm-hmm.
shortness of breath. Okay, that is
Okay. Okay.
your history make unorganized. Then
Yeah,
CVS,
yeah.
you ask very nicely heart racing, exercise intolerance, but in presentation you have not mentioned that. And then
Mm-hmm.
CNS, we can ask like any abnormal movement, any feeds, what about
Mm-hmm.
eyes, what about hearing, any behavioral change, irritability. 11
Yeah.
month old child, no need to ask the headache. Urinary, you
Yeah.
ask about the P. P is very important. P concern amount. If increase in frequency at night, blood pressure, because sometimes diabetes also. MSK, you
Yeah.
have
Yeah.
not asked. It's important. Any skin spots, any itchy or not,
Mm-hmm.
any swelling pain, because it's a chronic condition. Malignancy also can involve in
I
the
just
GD.
asked about swelling and rash. Yeah.
Mm.
Yeah.
Okay. Then you have not asked about the any unusual features are present or not, because rickets
Absolutely.
associated with the celiac disease, so bowing legs
Mm-hmm.
can be I
Mm-hmm.
mentioned. Endocrine,
Mm-hmm.
you ask hot or any swelling, it's okay. Hematology, any pallor you ask swelling net, yes you ask. Then
Mm-hmm.
past history, any trauma, any treatment the child is taking, any admissions, any surgery, any team following,
Mm-hmm.
any medication
Okay.
as she is not following any team you have not asked, right? Dietitian you ask. Parental
Mm-hmm.
history, you ask me details. Parental history like pregnancy, maternal disease, maternal drugs, illicit drugs, delivery time, type, fast cry. It's not needed. Actually, celiac disease, fast cry.
Yeah. Yeah.
NICU, any admission, meconium passage, yellowish discoloration, belly button loss, heel prick test. You have not
Mm-hmm.
asked the heel prick test.
Yeah. Yeah.
Then
Yeah.
puberty, there is not needed vaccination. Allergy, you have missed. Allergy is very important in this history because she is 11-month
Mm-hmm.
age old. 11-month age old, you need to ask about she is allergic or not. As facial eczema, I have mentioned you.
Like
And
in
another
the allergy, I what would I supposed to ask? Like, what do you like suggest?
allergy also very important in this history because in exam failure to type this question come as a mixing with the celiac disease and the cosmic protein allergy. Remember?
I
Clear?
mean, what? Yeah, yeah, you're right. What question you will ask in?
Like that, do you think the child is allergic to anything, any allergy in his body, any
Mm-hmm.
reaction occur anytime, like that?
Okay.
Nutrition
Okay.
you ask, but in nutrition, very important here. Who prepared the
Mm-hmm.
food? How many times the child is taking the food?
Yeah.
And also what type of meal you are giving, and also especially the cow's milk have you introduced or not?
Yeah.
Because
Calm.
cow's milk
Calm.
protein allergy in this age is one of the important development. You ask family first. You can ask like describe your family.
Mm-hmm.
Then any similar condition you ask,
Okay.
is there any siblings you ask, but
Mm-hmm.
how this disease impact you. You have 1 minute left.
Mm-hmm.
How this disease impact, do you want to tell me anything, that is how
Okay.
psychologically impact you? Okay,
Okay.
this line if you
Okay.
ask, then 1 minute can cover. Then at the
Okay.
end, okay, your
Okay.
history is okay, but you need to
Mhm.
organize much more. Otherwise,
Okay.
okay. So normally,
Okay.
loose motions, the red flags we think: dehydration, severe frequent diarrhea, failure to thrive, bloody diarrhea. Bloody diarrhea you have not asked. Bloody diarrhea very important, because
Yeah. Yeah.
Crohn's disease, ulcerative
Mm.
colitis, one of the
Absolutely.
DD come.
Yeah.
Cystic fibrosis. First, we can go celiac disease. Okay,
Mm.
number one.
Mm.
Number two, we can go cosmic protein allergy. Number
Mm.
three, we can go Crohn's ulcerative. We can keep it, but age
Mm.
is not supporting. We can
Yes.
go
Yeah.
cystic fibrosis. We can go
Yes.
any chronic malignancy type conditions,
Yeah.
immunodeficiency.
Mm.
Okay, so these
Mm.
are the our DD.
Okay.
And recurrent any oral thrush, any systemic upset. First, you
Mm.
make 4 or 5 DD. After that, you
Mhm.
will go.
Okay.
Okay, so
Okay.
DD of chronic diarrhea, I already tell you. Food allergy
Mhm.
also you can tell that food allergy. How can
Yeah.
I manage this child? So I already taken the history. So first I will examine the patient carefully. Take the
Mhm.
measurement. If I ask that, how can you manage your patient? First I will
Mm.
examine my patient
Mm.
carefully. Take his
Mm.
measurement and plot on the sentence. Then I will assess the dehydration status and ABCD, airway breathing circulations. I
Okay.
involve my senior and my consultant if need for admission, and I will run
Mm.
some tests. What are the tests we do? Diagnostic, lab, and radiology. Diagnostic test we do initially if symptomatic or high risk group, total immunoglobulin A, TTG.
Mm.
And if immunoglobulin A, TTG is tenfold more than upper normal, then we do immunoglobulin A, IMA.
Mm.
Immunoglobulin A, IMA is positive, then it is diagnosis for celiac disease.
Yeah.
If it's not more than tenfold or MI is negative, we go for biopsy after
Biopsy.
I consulted my. So initially
Absolutely.
I do two tests, hemoglobin A and hemoglobin A TTG, and we see that it is more than tenfold or not. More than tenfold
Sometimes,
positive,
na,
less than
doctor,
tenfold we go biopsy.
yeah, sometimes there is also initially we do because in celiac disease, 10% of there is a deficiency of IgA. So we have to do the serum IgA as you told with
Yeah, total immunoglobulin A and immunoglobulin A and
yeah,
TTG. These are
TTG.
two.
Yeah.
Hmm. And some lab test we will do for that. First diagnostic, then lab. Lab are HLA DQ2 and DQ8. Other autoimmune screening test we will do. Like for
Yeah.
diabetes, thyroid. Full blood count
Uh,
with iron study, ESR, CRP, stool analysis, microscopy and culture, bone
culture.
profile and RBS. Bone profile because rickets is associated with that. Okay?
Absolutely.
RBS.
Absolutely.
Mm. Then we do the radiology like abdominal ultrasound, DEXA scan,
Stool,
endoscopy biopsy, do
stool,
that.
stool analysis is also very done to rule out any
Mm.
GRDS is there or not,
Yes.
or if
Mm.
there is basically any
Fever,
cow milk.
inflammation,
Cow,
ESR, CRP,
yeah.
full blood
Mean
count with iron study because of anemia.
anemia, and we also have to do check for these protein in the stool, basically for these cow milk protein allergy as
Mm.
well. Yeah.
Okay, and gluten challenge test we do. If the child is less than 2 years, then we can do that.
Mm.
And
Yeah.
positive family history, then we are so how we can do that? Give at least 10 to 15 gram of gluten for 6 weeks. Then do the
Yes,
serological test. If positive, so proceed to the biopsy.
15 to
That is the
20 grams.
challenge test. Hmm.
Okay. Okay.
And multidisciplinary team, what we involve: pediatrician, my consultant,
Mm.
dietitian, GIT, orthopedic, endocrine,
Mm.
psychological support to the child and the family, liaison with the school and his condition. How can we
Yes.
follow up this patient? Follow up
Mm.
is like at the time of diagnosis, full blood count, thyroid function test, calcium profile, and RBS. After
Mm.
6 months, full blood count, iron profile, calcium profile, screening for complication. Like we tell that follow up, we do the full blood count, thyroid function test, calcium profile, RBS. Okay.
Mean
Uh,
when we diagnose a patient with a celiac disease, so we will have to rule out as thyroid problem as well. So we will
Mm,
also do T3, T4, and then at 1 year of age, we will. I mean, after 1 year, you will do thyroid, right? And I think
mm.
so. Diabetes is being ruled out. I think so at time of diagnosis, and then after every 3 to 4 years, if I'm not wrong.
No, I'm telling you, at the time of diagnosis, we do the full blood count, thyroid function test, calcium profile, RBS, this four test.
Okay. Okay. Do
Okay.
you have this one? Can you send in the group?
Okay, I will give the sheet.
Okay. Okay.
And
Okay.
advice we give about nutrition: strict gluten-free diet.
Gluten free.
Gluten-free diet, what she'll take: fruits and vegetables, beans, seeds, legumes, nuts in their natural, unprocessed forms, eggs, lean, non-processed meat, fish, most low-fat dairy product, vitamin A, vitamin D, iron. Avoid
That's
food
what.
containing gluten. What avoid? Hmm. What is avoiding the child? Wheat, rye, oat, bread, cakes and peas, candy,
Mhm,
cereals,
mhm,
communion, wafers,
mhm.
cookies and crackers. She will
Okay.
avoid. If
Okay.
the child not maintaining the diet, what will happen?
Mhm.
Risk of gastric lymphoma
Yeah.
mm.
Intestinal lymphoma. Yeah. Yeah. Yeah.
and endocrine problem occur in celiac are short stature, delayed puberty, vitamin D deficiency with secondary hypoparathyroidism and
Mhm.
osteoporosis, hyperthyroidism, and diabetes mellitus. So one history comes celiac with hyperthyroidism, that is a 15-year-old child. We will do another time. This is
Okay.
direct
Okay.
celiacitis. This is
Okay.
also recall. And type of
Okay.
anemia, we know that iron deficiency anemia, normocytic, normochromic anemia, macrocytic anemia, and hemolytic anemia occur.
No, I think
Remember?
yes.
So these are, I think, celiac disease questioned.
Okay. Thank
Celiac
you.
crisis is another thing. I am one line telling you. Celiac crisis is that acute onset of rapid progression of the gastrointestinal symptoms
Hmm.
attributed to the celiac disease. Like it is an acute presentation, like severe dehydration, diarrhea severe, weight loss, hypoproteinemia, metabolic and electrolyte disturbance. Then it is
Mhm.
celiac crisis. If they ask us, we can tell this line. So this is
Okay.
celiac disease. Discussion with history. So
Thank you
thank
so much,
you.
Dr.
We can
Naima, for
go
your
another.